Okay, we will move on to 6.3, our 915 item, consideration of letter requesting a change to federal law regarding Medicaid Inmate Exclusion policy. Supervisor Sabatier.
Thank you very much. A while ago, I started doing a little bit of research, especially in knowing that we were going to have to renew our jail medical. We've had those conversations for, I want to say, the greater part of 2022 until we finally approved the latest contract in December. And we knew that it was going to be an expensive endeavor to ensure that our inmates were provided the appropriate medical services. Had already reached out in the past to Senator McGuire to see what was possible to get help from the state. Had worked with our prior sheriff to figure out what the numbers were, and approximately, let me go ahead and share the document that I was working on, rather than just keep talking. Just a simple slideshow here. So what the letter talks about is MIEP, Medicaid Inmate Exclusion Policy. What it says here is that inmates in public institutions are excluded from Medicaid. This is in quotes at the bottom, any such payments with respect to care or services for any individuals. I can't read the rest, it's underneath. An individual who is an inmate of a public institution, and prior to that it talks about how any other medical care or remedial care does not include the following. And so inmates are excluded based on a 1965 law that was passed. That is ancient history as far as laws that are created, and nothing has changed since then. I had spoke with Senator McGuire about helping us because I knew that we were increasing our costs in jail medical. And approximately in 2010, the cost was $1 million. In 2022, when we approved the final contract, it was approximately $4.5 million. That's 450% increase in just about 12 years. That is a huge increase, and as we all know, healthcare continuously grows, is a major part of our overall economy, and it's difficult to keep figuring out how we're going to afford it. And just to remind the board, the majority of the $4.5 million comes from general funds. And so I decided to try to figure out how is it that we can change how things are working so that we can get some reimbursements. There is zero reimbursements based on that 1965 Social Security Act law. We cannot get reimbursed for the care we do unless an inmate goes into a jail, into a hospital facility and is admitted. Admitted is a key word because you don't always get admitted right away in a hospital facility, and you're admitted for 24 hours, then your Medicaid can go ahead and kick in and cover the costs. Some of the issues that we're seeing in our jail is due to Brown versus Plata. Not sure if you all remember, but our Supreme Court made a decision that our jails offered a cruel and unusual punishment to our inmates because of overpopulation. And so the aim of that court case was to reduce our jail population as we've been seeing the outcome of. And one major point in the Supreme Court case identified a lackluster medical care being offered in our prisons. And so, and sorry, I said reduce jail population, I meant prison population in there. I apologize for the wrong word. But we're seeing a change in our jails. We used to be limited mostly to 365 days or less. Now we're seeing folks with longer than 1 year's worth of sentencing that are in our jail, which means that we are coping with the needs of the inmates' medical care a whole lot more than before. And this places extra burden on us to ensure that we meet our mandates, and I agree with those mandates. We should take care of the folks that are in our custody. But it's becoming more and more expensive. CalAIM has changed some of these things a little bit. 90 days prior to release, Medicaid can now be reactivated. However, this is mainly to set up their release for continuity and follow-up to ensure that we reduce recidivism. This is not to say that we're going to provide all the medical care in the world to ensure that they're perfectly healthy as they leave. And in fact, there's very limited medical care services that are allowable under CalAIM. Again, this is mainly made to connect folks with the right agencies and the right facilities in order to continue to get care. And in speaking with the Sheriff's Department and our captain of the jail, Currently, it's believed that the impacts on savings to the county will be negligible as far as CalAIM goes and what it offers to our inmates. So there's two requests that are being made in the letter, which if the board chooses to change those requests, we can. The first request is to match what NACO, the National Association of Counties, is asking for. It's one of their main projects that they're working on, is to change it so that those who are in pretrial, that are pretrial inmates, continue to be covered by Medicaid. Right now, if you are in our jail facility, no matter if you're convicted or not, you are still considered an inmate. Therefore, that law pauses or strips the inmate individual of their Medicaid coverage. That is what NACO is looking to do, and I think we should definitely, at the very least, match that request. But I've expanded it, and I'm asking to request that all inmates be covered by Medicaid. I feel this is a very this is an ancient law that doesn't follow what it is that we're attempting to get accomplished here, not just in Lake County, not just in the state of California, but in the United States, which is to ensure that everybody has health insurance to cover them, to ensure a certain level of quality of life, and to now we have the deserving poor, because Medicaid typically covers those who are low income and poor. And now we also have still the undeserving poor, meaning you don't get to have access to medical coverage. This is a very strange situation to still have in the 21st century. I think that we should request both, not just what NACO is asking for. And hopefully what this does for us, it doesn't change the contracts that we have with jail medical, but it will change the fact that we can get reimbursed for the care that is provided. And so I do want to make a huge thanks to Matthew Rothstein. I drafted a letter and had it reviewed. Actually, I want to thank Crystal Marketan. I want to thank both our prior sheriff, Brian Martin, and our current sheriff, Rob Howe. I want to thank Jonathan Portney. They all reviewed the letter and provided some feedback, but Matthew Rothstein really took the letter and made it a much better document for us to submit, which a much more succinct request and ask on there. And so you have the letter in the attachments, you've had the chance to review it, and open for discussion or questions if there are any.
Well, obviously, this is a problem that's been compounding over time, but what was the original justification for this? Do you know? I mean, it's a completely different time, obviously, but does it?
To be honest, I don't know the original justification. I can see it as a way to save money, but maybe it was a little bit more than just that.
Okay.
And maybe one of the folks that I worked with can provide some better insight as to how we got there in the first place with the MIEP.
I don't think we have to put a lot of effort into it. I was just curious if anybody knew. Any other comments from the board? Any public input or comments from staff?
Sheriff Rob Howe, thank you. As Supervisor Sabatier said, this discussion predates my appointment. We have had some time to talk about it, and obviously any ability to seek reimbursement for extensive medical costs would be a benefit to the county and benefit to the sheriff's office. I thought I'd just throw out a number. Captain Taylor got me with NACO's proposal to allow pretrial inmates, that even that would be very beneficial. As of today, we have 199 inmates, 147 of them are unsentenced pretrial people, so be significant. And Captain Taylor's here to answer any questions if you have them.
Good morning, Board. Just to add to Sheriff Martin's statements, some of the just out of habit.
Captain Taylor,
Clearly.
can you say your name, please?
Captain Norm Taylor. I wanted to include some information about the people that are held in the custody at the jail and their situations in regard to medical care. Oftentimes, people come into custody and are released a short period of time thereafter, after attending arraignment and some court processes. But because they may have had Medicare or Medicaid, that benefit is suspended immediately upon them coming into the jail. However, we don't have a way to unsuspend their benefit. So then we release them back into the community without the benefit. So I think that gets repeated quite regularly, even with people that are sentenced. So we see it on both sides of that coin, because oftentimes the court process takes so long that when they appear in court and get sentenced, much of their time is already served, and they may only have a few more days left. So before we could actually communicate with social services, implement CalAIM protocol, and get them re-enrolled, they're released and back without any benefit. So that's certainly a consideration in this whole situation.
And the population that are not Lake County residents?
I haven't looked at that, quite honestly. The large majority are Lake County residents.
Any other questions? Oh, Supervisor Green?
Yeah, a couple questions. One, I thank you, Supervisor Sabatier, for bringing this forward. Certainly supporting the letter, but it raises some questions like if we don't get federal funding to get into more of a Medi-Cal reimbursement mode. This goes back to realignment and the Supreme Court ruling, and it's like if the state can't run prison populations and medical care to keep their constitutional rights happy, and it's going to stay in the county's realm, I certainly think we should try to get Medi-Cal and Medicaid fixed. But barring that, what are the constraints we're facing with right now, in terms of the quality of medical care we're able to offer? And maybe a question for Crystal, if she's still watching. MISP, are there non-Medi-Cal, non-Medicaid programs that are available for reimbursement, or are they likewise precluded from that because they're inmates, because they're in custody? So definitely it'd be nice if the feds would step up. I'm not going to hold my breath on that. So it raises the question of whether the state has any other bright ideas, having dumped this basically on us through realignment. And everything has come down to rain on us now, whether it's indigent defense or medical services in our jails. So is there anything other than Medicaid and Medi-Cal that can be brought to bear as financial resources to help provide services to our inmates?
In response to that, I don't know about the other programs. Looks like Crystal's available, but there's no doubt that we're realizing increased costs from realignment that maybe 10 years ago we didn't realize would be as heavy for us, but they just get larger and larger, and they compound as we continue to house inmates for extended periods.
Director Marketian?
Good morning again. I'd just like to start by saying we definitely support this request. We realize that it would be a big system change. But I do have our resident expert here, Rachel Dillman, who I would like to pass it to kind of explain more.
Sure. Yeah, we absolutely, like Crystal said, we do support this effort. There are some ways in which Medi-Cal can currently serve inmates. For instance, if an individual has Medi-Cal, when they enter the jail, we don't discontinue their benefits. We suspend their benefits until they are released. So they would have those benefits upon release. Some of the latest data shows about 70% of our inmates in Lake County Jail do have Medi-Cal when they enter the jail. So that is suspended and then reinstated upon release. But that's upon release. That's not during their incarceration. As Supervisor Sabatier said, the only program that's available during incarceration is the Medi-Cal Inmate Eligibility Program, which requires an overnight stay at the hospital where they're admitted. And then if the individual is eligible, Medi-Cal can pick up the cost. And then also the CalAIM program, the 90-day pre-release enrollment is actually starting in 2024. Right now, what we can do is enroll people upon their release, not prior to their release. So it would be great if we could do more for their inmates. I certainly support that. And if anybody has any questions about Medi-Cal, I'd be happy to try and address them.
Okay, any other questions from the board?
I don't know if Melinda wanted to say something.
Okay.
Doesn't look like it.
Anything from the public?
I see no hands in Zoom.
Okay.
And I'll add something. The state of California is not in the worst-case scenario. Other states still continue to strip Medicaid from their inmates. Our state, just like many others, have decided that we just suspend at this moment in time. But I do believe that we need to ask for change and see how we can work through the systemic change. But I just feel like this is a cost that eventually we will have to take away what we provide to the communities in order to ensure that we continue to provide this as it's a mandate. So if we could find ways to make it more affordable for us and continue to provide the appropriate services, that's the reason the letter is here. And again, looking for, do we approve the letter as written with both requests, or does the board wish to request just what NACO is requesting, which is just pretrial inmate coverage?
I'm fine with both requests.
Okay.
I mean, we may as well.
Same for me.
Okay. Thank you very much, Captain.
Thank you.
Thank you. Okay, bring it back for action.
Madam Chair, I move to approve, and in fact, I'm going to add a little bit. I want to make sure that we send this to Supervisor Gore in Sonoma County, since he is one of the executive board members of NACO and a representative of California. I want to make sure that he's aware of our letter. I did reach out to him, letting him know that this was on our agenda today. I want to make sure it goes to our state representatives so that they know what we're asking, and our federal representatives as well. And I think that should cover. And when I say federal, I mean both sides of the chamber. And so that will be, my motion is to approve the letter as submitted to eliminate the MIEP program and submit it to those I've just stated.
Second.
Motion and a second, all in favor?
Aye.
Opposed? Motion passes. All right, thank you. Thank you, Sheriff. Thank you, Captain.